The main purpose of this trial is to be able to determine the efficacy and the safety of Elmore oil. Well, we qualified our patients based on their ages and, of course, based on the clinical manifestations that they do have osteoarthritis. The inclusion criteria for the age is below 90 and below 45. So we started by screening the patients. Of course, we did an interview and physical examination of the patients, and we ordered what we call a baseline laboratory studies, which are the studies for the liver, which is the SGPT and SGOT, and then the kidney function test. And most importantly is we also did a CRP, a C-reactive protein test, the erythrocyte sedimentation rate, which is what we call ESR, and also we did the uric acid determination to be able to rule out the possibility of gouty arthritis. During the physical exam, initially, we took pictures of the knees, and we have noticed that the knees of all these patients are somehow swollen, and when you feel it and touch it, it is warm to touch, and there is some kind of tenderness. So those are the signs of inflammation on the patient. The signs of inflammation also will be coupled with the positive test on CRP and also the increased ESR rate. During the screening, we give them a 1-week diary. That means that we will be able to assess before the Elmore oil application how the pain was before. So we did that plus the patient information that will give us an idea of how long the patient has been having the osteoarthritis and what are the medications the patients are taking. So the diary starts there. And then after we give the Elmore oil, we issued the samples. Then we give them a 4-week, 5-week diary, 1 week during the time that it has started, the 2nd week, the 3rd week, and the 4th week. And the 5th week will be what we call a flash out period, wherein they will stop completely the use of Elmore oil. And then inside the diary, they will be able to assess the severity of their pain, if ever the pain improved from a number 7 to number 6 to number 5 to number 4 until it goes to 0. And then coupled with that, there is also an assessment of the quality of life, wherein they will be able to assess if they're sleeping well, if they can go about their household works or office works. And very important, during the diary, when the application of the Elmore oil is going on, they must be able also to list down if ever there is maybe an allergic reaction to Elmore oil. At this stage, I can say that it's very effective. I've seen a lot of changes in their external appearance. Whenever they walk in, they're walking without the cane, without the aid of the cane. Their faces are not the wrinkled face, but now with happy face, and things like that. And then whenever they come in, they will raise their hands and like, "Look at me, doctora." And there is a marked and significant change in the degree of the pain. At this point in the study, I believe that it will be a very significant part of the treatment regimen of osteoarthritis. So it will be a permanent prescription for all osteoarthritis patients. Elmore oil is really an effective treatment for arthritis. And I believe also that after this clinical trial, it will be a prescribed supplemental medication or treatment or management to osteoarthritic patients.